So, my name is Wendy Chapman. I direct the Center for Digital Transformation of Health at the University of Melbourne. I'm coming to you today, though, from Sydney. Had to be here for a Australian Institute of Digital Health, Women in Digital Health Leadership program that I started, and today is the graduation, and so visiting Sydney for that. I'd like to acknowledge the traditional custodians of the land that we're on. And honestly, I didn't check this, but since I'm in Sydney, I'm not sure whose land I'm on right now. At the University of Melbourne, we're on the land of the Wurundjeri people of the Kulin Nation, and also like to pay our respect to elders past and present. Welcome to the Making Digital Health Equity a Practical Reality Symposium, hosted by the Center for Digital Transformation of Health at the University of Melbourne. This event's been sponsored by Network for Equity through Digital Health, or NEED, from Monash University, and the Center for AI and Digital Ethics, or CADE, at the University of Melbourne. On behalf of the university and our partners, we thank you for joining us. And I'll tell you a little bit about the Center for Digital Transformation of Health. We are a fairly new center at the University of Melbourne that's recognized the importance of technology and data in supporting our care of patients and advancing health. We are one center that is across two different faculties, the Faculty of Medicine, Dentistry, and Health Sciences, and Computing and Information Systems. Our mission is connecting and bringing all the pieces together towards our vision of connected health. And we see that there are so many different disciplines that are required in order to really digitally transform healthcare, and we're trying to bring those together. So why is this important? If you think about the drug development pipeline, it's very clear how we go from an idea of developing a drug to marketing the drug. Everyone knows the steps, they know the pathway. But in digital health, there's a huge gap in implementing and evaluating digital health innovations. And our center aims to develop processes and frameworks and tools and resources to help bridge that gap. To do that, we've created something we call the Digital Health Validitron. And this is pre-assessment of an idea that tries to be very comprehensive, including the economic modeling to see, is this something that could really be sustained? It's a platform to help develop, co-design, and validate digital health interventions in simulated settings to prepare them for the real settings. And to do this, it really helps de-risk the development of new technologies and new digital interventions, and allows the users, the stakeholders, clinicians and patients particularly, to help design and test out all of the components before you put them into the real thing. We also have an education mission that's really focused on educating the workforce. We have a learning health system course that we're offering, that we've offered. We're on the third round of it. It's starting in September again. It's a 13-week course to help train the next generation of digital health professionals in learning health system methodology. But for this symposium, we are here to talk about the poorly designed or implemented digital health technologies can really worsen health outcomes of socially marginalized or disadvantaged populations. And so as we develop new technologies, we can see the digital divide growing. And just as social determinants of health, such as safe housing, education, job opportunities, or access to services influence health disparities, digital determinants of health, such as access to technology and confidence to use the technology, can also affect people's health outcomes and will increasingly do so in the future. This new digital health equity framework was developed by Richardson and colleagues at New York University, and it examines the digital determinants of health at the individual, interpersonal, community, and societal levels. It provides a multi-level approach for embedding equity in digital health solutions. And for those who are attending the in-person workshop on Friday, you'll have a chance to apply this framework to a real-life project. In today's symposium, You'll hear real examples addressing the many levels of digital health equity and providing ways that digital interventions can address other types of inequity. So now for some quick housekeeping. We want to hear from you. Please keep the dialogue going in the question and answer box. Tell us about your experiences of digital health equity and your aspirations for the future, the challenges that you're facing. If you have questions, post them in the Q&A panel to the panelists. And feel free to post on social media using the hashtag digital health equity or hashtag DT4H, that's digital transformation for health. And you can also tag us at DT for health. We have a short 15-minute break at 10:30, but in this morning's session, we have incredible speakers who've all been researching, developing, and implementing equitable digital health. I'm going to introduce each of them before they speak, but I'd like to thank Professor Margaret Simmons, Professor Shantan Chang, and Dr. Rose Pockholder for joining us and sharing their knowledge in session 1.